my name is Kehlani Johnson, and I will be giving my TED Talk on my research proposal for the longitudinal study of psychological effects and mental health of those who undergo gay conversion therapy versus affirmative therapy, and how outlawing gay conversion practices for minors under age 18 can save lives. Sexual orientation has been at the center of social liberties for a number of years and still is. Previously, there had been many people on each side of the debate as to whether sexual orientation was a conscious choice or something determined at birth. As time went on, genetics developed more, and we found many theories pointing to hormones during fertilization and early stages of prenatal development, which may influence brain development and what sexual orientation the individual is born with. We know now that we are almost completely a product of our genetics. Our genetic makeup and our environment influence us, and that most behaviors and phenotypes are due to a number of genetic factors. Now let's look at things from a more psychological standpoint. For many years, mental health professionals in psychology and psychiatry listed homosexuality as a mental condition, as a mental illness. First appearing in the DSM-1 as seen here, published in 1952, homosexuality was listed in the sexual deviance section. Again, put in the DSM-2 in 1968. As you can see, the entry here from the DSM-1, it says that the sexual deviation is a diagnosis reserved for deviant sexuality, which is not symptomatic of more extensive syndromes. The term includes most of the cases formerly classed as psychopathic personality with pathological sexuality. The diagnosis will specify the type of the pathologic behavior, such as homosexuality, transvestism, pedophilia, fetishism, and sexual sadism, including rape, sexual assault, and mutilation. As you see, it used to be that homosexuality was compared with things like pedophilia, rape, and sexual assault. It took until 1980, when the DSM-3 was released, that sexuality was finally taken out of the DSM and no longer considered a mental illness. Still, homosexual individuals are often in need of therapy or help in some form due to trying to make sense of living as a homosexual individual in a primary heterosexual society. The best decided course of action to take is affirmative therapy. Affirmative therapy is the most widely accepted form of therapy by not only American Psychiatric Association, but American Psychological Association and most mental health professionals in treating those who are homosexual and struggling with self-image, self-identity, and acceptance in their community. It works off of the notion that homosexual urges are natural and focuses on helping the patient be at peace with one's natural given sexual orientation and puts them in touch with others in the LGBT community. However, much like there are those who claim homosexuality is a choice, there are also those who think it needs to be fixed and are trying to cure it and remove it from our society. This man is Joseph Nicolosi. He's a creator of conversion or reparative therapy, and he has written numerous books on reparative therapy, such as Healing Homosexuality, Journey to Manhood, and even a book for parents on a guide to how to keep your child from becoming homosexual. He uses a lot of fear to push the agenda of eliminating homosexuality from America. As you can see, a common theme in his books is that homosexuality is a mental condition that needs to be cured and fixed through therapy. I'm going to read a quote by Nicolosi. When you look at gays, their relationships are more short-term. There's more depression, anxiety, self-defeating, self-destructive behavior, and alcohol abuse. Nicolosi confuses correlation with causation as he attributes these gay and lesbian people to have these traits because they are gay and lesbian. He tries to say, using some accurate statistics, that they have increased depression and anxiety, self-defeating behavior. These things are true, with common misconceptions such as short-term relationships and alcohol abuse, in order to convince others that homosexuality is a harmful state that needs to be removed. However, he skews these accurate statistics rather dishonestly by telling two lies and a truth. Yes, homosexuals tend to have more anxiety and depression, but it is not due to their being homosexual. It is due to the lack of support in their environment and the abuse that they face often in their environment. Despite the overwhelming evidence of harm which his therapy causes, he still insists on doing it despite the fact that in his state of California it has been outlawed for minors. He says that this does not apply to him or what he does. Here are some of his books. Conversion therapy needs to be outlawed for all minors. Young adolescents with absolutely no right to consent are being sent by their desperate parents who are just trying to find some way to aid their children and give their child a better chance of being accepted in society. However, at these activities, the adolescents are made to feel shame for their urges, made to feel sinful, told to get right with God, and to rid themselves of these feelings, and in some cases even given negative punishment for their natural feelings through pain or electric shocks. While testimonies have been gathered from numerous people about the heavy load of emotional and mental damage caused by conversion therapy programs and camps, conversion therapy still exists. Some are even licensed mental health professionals. Despite the numerous conversion therapy leaders who have come out as homosexual, apologized for their horrendous acts, who have admitted their therapy doesn't work, and who have switched over to joining the cause against conversion therapy, the battle is not won. This is why I propose a longitudinal study to uncover the true effects of conversion therapy on mental and emotional well-being compared to affirmative therapy. As you can see, there have already been a few studies done. However, affirmative therapy is still new, so there hasn't been many. But conversion therapy leads to a lot more positive results due to the mindset and the beliefs behind it, while conversion therapy is much more threatening to the person's happiness, self-confidence, and sense of self. For my study, the researchers will follow two groups of people: the conversion therapy, the CT group, and the affirmative therapy, the AT group. In these two groups, there will approximately be about 50 participants, 25 men and 25 women. The participants will be followed through a week of their selected therapy for understanding their homosexual urges, a therapy that supports their growth, or a therapy that tells them they are off the path and tries to change them. During the programs, the researchers will participate in activities, take notes, make observations, and they will be giving a PANAS assessment before and daily on negative and positive affect, as seen here. However, in the conversion therapy groups, I believe negative affect, which is the amount of negative emotions experienced, will either stay the same or increase from the baseline. Follow-ups will be conducted at 4 intervals: 1 month after treatment, 6 months after treatment, 1 year, and 5 years. I hypothesize that negative affect will continue to increase for conversion therapy participants due to lack of support and acceptance in their environment. A self-report measure of happiness and self-confidence will also be given, starting as a baseline and then administered daily. I hypothesize that this scale will show increasing levels from baseline in both groups. However, for the CT group, the score mean will peak at the end of the program, and then I believe will start to decrease from there, while the AT group, we will be expected to see a steady increase in mean scores for happiness and self-confidence reports. This study should be able to assist many people as the hypothesized data can be used in determining new state laws in outlawing conversion therapy treatment in minors. Hopefully, with this study, the word to change will get out to adults as well as those who may lack support from their community and feel pressure to attempt to change their sexual orientation from their given desires. To save people the trauma and confusion caused by conversion therapy and people like Nicolosi would be a big success. Nicolosi may have a mental health license and participate in psychology practices, but he is not a true scientist. Scientists constantly look for what's newly discovered in order to improve the lives of their patients. Scientists seek enlightenment and knowledge, not hang on to outdated ideas proven wrong time and time again by fellow researchers. Let us all move into the future of science and society. Thank you.